Let me give you a very simplified explanation to why this logic is flawed. Usually when somebody asks us questions, well, if the nurses go on strike, who's taking care of the patients? It's rooted in ethics, right? You're concerned about patient safety. So the first thing I'm going to tell you is one of the most common reasons nurses go on strike is because the conditions are not safe for patients and they want to make a permanent change. The second thing I'm going to tell you is that nurses don't just decide to go on strike and leave the hospital high and dry with no opportunity to prepare. That never happens. In fact, before they even vote to strike, they're usually talking to the hospital about what their grievances are, and the hospital is refusing to change. Once the nurses vote that they want to go on strike, they will give the hospital notice. Legally, they're obligated to give about 10 days, but a lot of times they'll give well beyond that, 2 weeks, 3 weeks. Hell, it feels like we've been talking about the nurses in New York about to go on strike for like a month now, right? Here's the part where you really need to reshape your understanding of what a hospital is and what a patient is. Hospitals are a business. Patients are their clients, right? As a business, the hospital cares about two things: their reputations to the clients that they serve or the immediate public around them, and their profits. From the time that the hospital gets notice that these nurses are going on strike starting a certain date, the hospital has several strategies that they're well aware of that they can take to address these types of concerns. Strategies can be broken up into two categories. The first category are things that will cost them money and or minimize their profits. The second category are things that they can do that won't cost them money and in fact will help them continue to make profits and operate while disregarding what the staff is asking for. In this first category, you have a few different things. The first is they can go on divert. This means that they're no longer accepting patients to that hospital. In other words, no more new clients. The second thing they can do is they can transfer patients out of the hospital to other hospitals. In other words, they're losing current clients. The third thing they can do is stop procedures, which is one of their main sources of income. Procedures make a lot of money. In the second category of things that won't cost them money and will allow them to continue making profits, one of the main things is they're going to use their insurance to hire strike nurses to staff the hospital. They're not going to receive adequate training. They're working on equipment that they're not familiar with and a hospital they're not familiar with, and they're going to be stretched well beyond what is considered safe to standard nurse to patient ratios, more so than what the staff was already experiencing. In other words, the patients are still not safe. Per the National Labor Relations Act, nothing can interfere with this legal strike. So if they don't have option B, i.e. nobody takes strike contracts, they're forced to go with column A. That's going to cut into their profits and their reputation, and they're more likely to fold.